Module 2 by Elizabeth Horton. Question 1 says, which of the following is a characteristic of a specific learning disability? A. Difficulty with social interactions. B. Challenges in reading, writing, and math. C. Impulsivity and hyperactivity. Or D. Difficulty with speech sounds. The answer is B, because SLD is reading, writing, and math. Some students have a disability in more than one area, such as having a difficulty is understanding the number concepts, calculations, grammar, or punctuations. Question 2 says, blank involves teaching in specific concepts or procedures in a highly structured and carefully sequenced manner. The answer is C, explicit instructions. Exceptional learners are students who require specialized educational support due to diverse needs. This group could be children with disabilities, children that are gifted, or learning disabilities such as ADHD. Differential instruction personalizes learning to each student's cognitive, emotional, and language needs. Sheltered instructions make content accessible through language and scaffolding support. Question 3 says, what is a common sign of autism spectrum disorder? A, the lack of interest in activities. B, excellent verbal communication skills. C, always completing assignments on time. Or D, strong preference in routine. Common signs of autism affects the communication. Social interactions and repetitive behavior are some signs. For example, communication could be difficult, taking cues from others. Communicating only to get needs met. Repetitive patterns of behavior, such as lining toys up on a line, just like we saw on the video. Question 4 says, which of the following is not a characteristic in reading for students with specific learning disability? A, an exceptional reading fluency. B, difficulty with decoding words. C, inability to comprehend age-appropriate text. Or D, challenge with spelling words. The answer is A, exceptional reading fluency. Even though some students struggle with reading fluency, but some may have other areas of strength. While reading fluency is a common problem, some students with SLD might have other areas of weaknesses, such as spelling, writing, and math. Question 5 says, which of the following is not recognized type of ADHD? A, combined presentation. B, specific learning presentation. C, predominantly inattentive. Or D, predominantly hyperactive. The answer is B, because a specific learning presentation relates more to learning disorders, not to ADHD. Combined presentation is an individual who shows significant difficulties with attention, staying focused, as well as excessive movement or impulsive behaviors. Predominantly attentive presentation, the person may struggle to sustain focus, follow through on a task, or organize activities with little to no hyper or impulsive behavior. Predominantly hyperactive impulsive presentation, these individuals may have difficulty sitting still, talks excessively, interrupts others, or organize activities but shows little to no hyper or impulsive behavior. Each type reflects a pattern of behaviors that helps tailor, diagnose, and treat. Question 6 says, what does the term expressive language refer to? A, being able to understand spoken language. B, being able to express or communicate thoughts. C, being able to recognize speech sounds. D, the use of nonverbal communication. Expressive language is being able to express or communicate thoughts, incorporate or understand of ADHD. The correct answer would be B. Because children with different types of ADHD may experience challenges with expressive language in distinct ways, like the three that we talked about in the last slide. The combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. These three were talked about in the last slide. Question 7 says, why is early intervention important for children with speech and language impairment? A, it assures they won't need any further assistance. B, it guarantees such academically success. C, it allows no type of therapy. Or D, it decreases the likelihood of having a social issues later in life. The answer is D, because it addresses challenges before they become more deeply rooted and harder to manage. And the last question says, blank means the disability that is characterized by behavioral or emotional responses. A, dyslexia. B, phonemic awareness. C, emotional disorder. Or D, ADHD. The answer is emotional disorder because it involves managing feelings such as anxiety, depression, mood swings. Phonemic awareness is manipulative of sounds, and that is the reason why it can't be that. So the answer is C.